Ever wondered about the actual cost of neuropathy? Not just in dollars, but in quality of life? Neuropathy, a nerve disorder, is a silent epidemic affecting millions. The financial burden is immense with ongoing medication costs and frequent doctor's visits. But these expenses only scratch the surface. They address the symptoms, not the root cause. As a result, the condition often worsens over time, significantly impacting day-to-day life. Neuropathy is not just a medical condition, it's a life-altering experience with a hefty price tag. So, what exactly is neuropathy? Let's break it down. Now imagine a sprawling network of telephone lines connecting every corner of a bustling city. These lines represent your nervous system, a complex grid that relays messages between your brain, the command center, and every other part of your body. Neuropathy occurs when these communication lines, or nerves, get damaged. It's like a storm wreaking havoc on the telephone lines, disrupting the flow of calls and causing confusion. Symptoms of neuropathy can manifest as a tingling sensation akin to pins and needles, a sharp, jabbing pain, or even numbness. It's as if the city's inhabitants start speaking different languages, creating a chaotic mix of signals that the brain struggles to interpret. And this, my friends, is just the tip of the iceberg when it comes to the complexities of neuropathy. This is a condition that is deeper, broader, and more serious than it may initially appear. Now that we understand what neuropathy is, let's dive into its causes. Neuropathy, the damage or dysfunction of one or more nerves, can be triggered by a plethora of factors. The most common culprit? Diabetes. High blood sugar levels can injure nerve fibers throughout your body, but neuropathy strikes your legs and feet most often. Then there's chemotherapy, a life-saving treatment for cancer patients, but with a dark side. It can cause chemo-induced peripheral neuropathy, a debilitating condition that can persist long after treatment ends. Medications too can be a double-edged sword. While they cure ailments, some can also inflict nerve damage as a side effect. Certain antibiotics, antivirals, and even medications for blood pressure can lead to neuropathy. Back surgeries aimed at relieving pain can ironically result in neuropathy. Post-surgical inflammatory responses or inadvertent nerve damage during surgery can cause this unwanted outcome, and the list doesn't stop here. Other causes include autoimmune diseases, infections, inherited disorders, tumors, bone marrow disorders, and even exposure to toxins. Let's not forget lifestyle factors. Alcoholism, for instance, can lead to nerve damage due to its toxic effects on nerve tissue, while poor dietary choices can cause deficiencies in vitamins that are critical for nerve health. So, you see, neuropathy doesn't discriminate. It can strike anyone, anytime, due to numerous reasons. We've talked about the financial cost of neuropathy, but what about the hidden costs? Beyond the bills and prescriptions, neuropathy takes a toll that's not so easily quantified. It stealthily creeps into all aspects of life, casting long shadows over your emotional well-being and psychological health. Imagine the strain of constant pain or discomfort on your relationships. It's not just about you, but the people around you who share your journey. It's a ripple effect where your struggle becomes their struggle too. Now think about your work. Neuropathy can affect your productivity, your focus, and ultimately, your livelihood. It's a relentless tug-of-war between your aspirations and your physical limitations. And what about the overall quality of life? The simple pleasures that once brought joy are now overshadowed by the constant specter of pain. Neuropathy isn't just a physical ailment, it's a silent thief that robs you of joy and comfort. It's a hidden cost, one that's often overlooked but is just as significant as the medical bills stacking up on your desk. Is it all doom and gloom? Certainly not. There are ways to fight back against neuropathy. Let's shift our focus from merely treating symptoms to addressing the root causes. It's crucial to understand that neuropathy often stems from underlying health conditions like diabetes, certain medication side effects, chemotherapy, or even back surgeries. Therefore, comprehensive care is essential. This care might involve managing blood sugar levels for diabetics, or making lifestyle changes like quitting smoking, limiting alcohol, maintaining a healthy weight, and exercising regularly. Physical therapies and alternative treatments like acupuncture may also be beneficial. It's also about empowering yourself with knowledge. Educate yourself about your condition and its triggers. Understand your treatment options. Consult with your healthcare provider to create a personalized plan that tackles the root cause, not just the symptoms. Remember, neuropathy is not a life sentence. With the right approach, you can reclaim your life.